Now let's look into our next topic, poisoning. Poisons are substances that can cause temporary or permanent damage if too much is absorbed by the body. We will be looking into two different types of poison cases which would require first aid at our workplace. 1. Food poisoning. 2. Carbon monoxide poisoning. Let's look into some details about food poisoning. Food poisoning is caused by eating contaminated food. In most cases, the food hasn't been cooked properly and is contaminated by bacteria such as Salmonella or Escherichia coli or E. coli, which are found mainly in meat. Someone may feel the effects of food poisoning within a few hours and will often be sick or have diarrhea. However, in some cases, it can take up to 3 days. The effects of food poisoning can make someone feel extremely ill. The most important thing for you is to keep encouraging the person to drink water so they don't get dehydrated. Most people will get better without needing treatment. How can we identify food poisoning? The normal symptoms for food poisoning would be feeling sick, vomiting, sometimes blood-stained, diarrhea, stomach cramps, headache or fever. If you notice any of the previous symptoms, tell the person to lie down and rest. Give them plenty of water and a bowl to use in case they are sick. Encourage them to drink as much water as they can, even if they can only manage regular small sips. If they have diarrhea, it's even more important that they drink water to replace lost fluids. Give them an oral rehydration solution, which is good to replace fluids lost through diarrhea and vomiting. This solution can replace salt and other minerals which they have lost. You can buy it at a pharmacy as a sachet which you can dissolve in water. If the person gets worse, then advise them to call their doctor or call for emergency medical help. Now, let's look into carbon monoxide poisoning. If volumes of smoke or gas are inhaled or breathed in, it can be deadly. Carbon monoxide is a poisonous gas. When inhaled, the gas directly prevents the red blood cells from carrying oxygen to the body's tissues and organs. It can quickly prove fatal if it is inhaled in large amounts. Carbon monoxide is difficult to detect as it has no taste or smell. Unfortunately, lots of people who have carbon monoxide poisoning may not be aware that they are affected and may wrongly blame their symptoms on other reasons. It is best to reduce the risk of poisoning by making sure that gas appliances are serviced regularly and by fitting an approved carbon monoxide detector in your home. How can we identify the symptoms of carbon monoxide poisoning? Check the victim for the following: headaches, confusion, feeling aggressive, nausea and vomiting, diarrhea, gray-blue skin coloration, rapid difficult breathing, impaired level of response leading to unresponsiveness. What you should do: 1. Call the emergency services and tell them that you suspect inhalation of fumes. 2. If necessary, get them away from the source of the fumes into an environment with fresh air. Do not enter the fume-filled area yourself. 3. If the causality is in a closed space filled with exhaust fumes, open the doors, letting the fumes escape before you enter. 4. Support the causality in a comfortable position and encourage the causality to breathe normally. Reassure them, stay with them until the emergency services arrive. 5. Treat any burns or other injuries. 6. Monitor the causality by keeping an eye on their breathing, response, and pulse. If the causality is unresponsive, open the airway, check for breathing, and if necessary, start CPR or cardiopulmonary resuscitation. From the below given symptoms, which one is correct for food poisoning? Now let's look into the next topic, heat stroke.